Aspartame is a multi-potential carcinogenic compound. Aspartame causes leukemia, lymphoma, and breast cancer. Pregnant women who consumed soft drinks containing artificial sweeteners had premature births. The European Food Society Authority and the US Food and Drug Administration have recognized aspartame as safe. Aspartame is an artificial low-calorie sweetener used since the 1980s. It is 200 times sweeter than sucrose. In the body, aspartame is completely broken down to its components: amino acids, aspartic acid, phenylalanine, and a small amount of methanol. The last three products are toxic in large doses. Phenylalanine is an essential amino acid, but elevated levels of it can cause brain damage. It is especially dangerous for children with phenylketonuria, a hereditary disease in which the body is unable to metabolize phenylalanine, causing it to accumulate in high doses and damage the brain. Aspartame and phenylalanine are contraindicated in children with phenylketonuria. The undesirable effects of phenylalanine are exacerbated when consumed with high carbohydrate foods. Carbohydrates trigger the release of insulin into the blood, which in turn makes it easier for phenylalanine to cross the blood-brain barrier. In animal studies, aspartame increased the frequency of SAGEs. In some people, aspartame can cause headaches and dizziness, gastrointestinal problems, and mood swings. Can aspartame consumption provoke the growth of tumors in the body? A study published in 1996 claimed that a 10% increase in brain tumors noted in the 1980s was due to the ingestion of aspartame. It was suggested that aspartame or its breakdown product, decatopiperazine, could combine with nitrites in the diet to form nitrosated compounds. Nitrosurias are actually known to cause brain tumors in animals. In 2005, scientists from the Ramazzini Foundation in Bologna, Italy, conducted a study that showed a significant dose-dependent increase in the incidence of lymphoma, leukemia in male and female rats. They stated that aspartame is a multi-potential carcinogenic compound whose carcinogenic effects are evident even at a daily dose of 20 mg per kilogram of body weight. This dose is much lower than the current acceptable daily intake for humans in Europe, 40 mg per kilo of body weight, and in the United States, 50 mg per kilo of body weight. As one of the arguments in defense of aspartame, the industry and FDA cite a 2006 human study conducted by scientists at the US National Cancer Institute. The study involved a large number of adults between the ages of 50 and 71 over a 5-year period. The study found no evidence that aspartame poses a risk. However, the NCI study had three main limitations. Firstly, the study didn't involve really old people. Italian studies observed rodents before their natural death. Secondly, the subjects didn't consume aspartame long-term or in large quantities. And thirdly, it wasn't a well-controlled study. Subjects provided only a rough estimate of their aspartame intake, and people who consumed aspartame may have had other dietary or lifestyle differences that offset the effects of aspartame. In 2007, the same Italian researchers published the results of a follow-up study in which rats were exposed to aspartame in the womb. This study showed that aspartame causes leukemia, lymphoma, and breast cancer. In 2009, the European Food Society Authority reviewed the results of the study and concluded that the tumors were probably accidental. Allegedly, these are just coincidences. Then, in 2010, restless Italian researchers published the results of another experiment. Mice were exposed to aspartame from intrauterine development throughout their lives. This study showed that aspartame causes liver and lung cancer in male mice. The study and the Italian lab's accuracy in diagnosing cancer in rats have been questioned. Notably, a study published in 2020 using state-of-the-art diagnostic methods confirmed 92% of lymphoma leukemia diagnosis in a rat study. Moreover, the occurrence of tumors was statistically significant. Meanwhile, the most thorough long-term study of aspartame in humans was conducted by researchers at the Harvard School of Public Health. The study found the first evidence that aspartame slightly increases cancer risk in men, but not in women. The researchers speculated that this may be because men have higher levels of an enzyme that converts methanol, the breakdown product of aspartame, into formaldehyde, a carcinogen for humans. Formaldehyde is part of formalin, used for embalming corpses, as a lubricant in the sex industry, and in the production of vaccines. Harvard researchers couldn't prove that aspartame is a carcinogen, but they raised concerns about its safety. Another study conducted by American Cancer Society scientists, not as large as Harvard's, doesn't support associations of daily consumption of artificially or sugar-sweetened carbonated beverages or aspartame with cancer risk. Another aspartame-related problem emerged in 2010. Danish researchers found that pregnant women who consumed soft drinks containing artificial sweeteners had premature births. Researchers didn't specify exactly what sweeteners were in the drinks, but it is known that aspartame and ace-sulfame potassium were the most commonly used in those countries. In 2012, another study, this time conducted in Norway, confirmed the Danish scientists' conclusion. It also found a link between sugar-sweetened beverages and premature birth. The fact that two large independent studies found a link between artificially sweetened beverages and preterm birth is troubling. Pregnant women should avoid or at least reduce their intake of aspartame and ace-sulfame K and consume added sugars in moderation. Aspartame is now found in more than 6,000 products, including more than 500 pharmaceuticals. Not surprisingly, the European Food Society Authority and the US Food and Drug Administration have recognized aspartame as safe. At the same time, it's impossible to turn a blind eye to the studies cited earlier. It is impossible to ignore the ever-increasing number of cancers in humans. Will you at least now read labels and be conscious of your food choices? The choice is yours. The next video will be about another dangerous sweetener, saccharin. Take care of your body and mind.